All right. Well, welcome back, everyone. Welcome to day 2 of the HCS convening. I hope you all enjoyed our first day. Feel free to share a highlight from yesterday in the chat. And now it is my great pleasure to introduce to you all Paul Tarini, Senior Program Officer from the Robert Wood Johnson Foundation, who will be leading our grounding and welcome for the day. Take it away, Paul.
So good morning and good afternoon to everyone. Thanks for joining us again. I want to just start with a brief moment of silence to think about the year that we've been through and the challenges that we're working on. So if everybody could just take a moment. Thanks. And I will confess to you all that in years past, when people said, let's take a moment of silence, I was like, okay, let's go ahead and do that. But given what the past year and a half has held, I'm really finding them to be personally important. So thank you all for indulging me with that. So we're excited to be back with you today as we dive deeper into this work. Echoing Alonzo's welcome yesterday, we are on this learning journey with you, and we are learning so much. And our hope for you all in this convening is that you learn from each other and the great set of speakers and the panelists that the ISC team has convened. I think yesterday's sessions really delivered on that. We see the work that you're doing is really helping develop and share evidence of what works to improve health and address climate change and advance equity. But it's also critical in that it's helping people connect those 3 dots and to see that they're really 3 entry points into the same problem. And it's helping us all see that to address that problem, we need to act holistically and with intention if we want to create a healthier and more equitable society. We also want to thank everyone who shared their thoughts and experiences with the evaluation team when they conducted their assessment of this program. We're reviewing the initial results, but we heard loud and clear that the last year has been a challenge on so many fronts. COVID has affected us, all of us, personally and professionally. The racial reckoning that our nation is struggling with is affecting us personally and professionally. And all of that factors into how you guys are doing your work. One specific thing that we heard from you all is that the transition in leadership and support for this program was disruptive, and it could have been and should have been handled better. And so we apologize for that, and we hope things will be smoother now that the new team is firmly in place. I know that Sharon and I have worked with many of you on time extensions and budget revisions, and those have worked their way out. And we want to reiterate that you should reach out to Sonia with any questions or concerns and things that ISC needs to triage us at the foundation. They'll do that. But we have a lot of confidence in Sonia and the team there at ISC. We also wanted to give you an update today on where we are with thinking about this funding going forward. We're working with our colleagues at the foundation to shape the next phase of this work. And we heard your advice and that of others who participated in the program assessment, and we appreciate your input. You all raised some really important questions about how we approach this work and the role that RWJF as an institution can fill. We heard about the value of highlighting bright spots in local solutions, and also about how we might think about shifting to a focus more on policy and systemic level approaches. these aren't mutually exclusive, but sometimes there's a tension between them. And so that's an example of the kinds of questions that we're asking ourselves as we're thinking about how we move forward. But that said, we want to assure you all that whatever the next phase of this work looks like, the focus will be on the people and communities whose health and way of life is being disproportionately harmed by climate change. We also wanted to share with you another update about RWJF's work on health and climate. Some of you may have seen that the foundation is supporting a new group of 6 grantees through our team, Global Ideas for U.S. Solutions. That funding team supports, that project supports U.S. cities as they translate and adapt approaches tested in cities around the world to curb the health impacts of climate change. The project range from building circular economies and green corridors to mitigating the impacts of extreme heat and sea level rise through community-driven designs. And with these grantees, there's a focus on equity and deep community engagement. Sharon, my colleague, is the force behind that program. And I think she's put a link in the chat to where you can find more information about that program if you're interested. Also, there's some communications research going on around climate. And as we're getting the results of that, looking at the understanding of climate and health and equity, it's clear that that's a complicated thing. The good news is that people are pretty accepting of the fact that climate change is harming our health, and people agree that we should act. We're seeing a challenge, though, that we need to help increase urgency for that action, and that we need to help folks understand better that climate change impacts the health of some people and communities harder than others, and that it will make their lives worse unless we act in ways that center equity moving forward. But this means that your projects can make a real impact on your communities and on the country and other efforts around the country. It means that the power of your stories and the examples that you have can bring more people along to this work. And that would be a good result. So thanks. And I'm looking forward to the rest of the day.
Great. Thank you so much, Paul. And for those of you who have just joined us, please feel free to also in the chat share one of your highlights from yesterday as we enter into our day 2.